All right, welcome back to ABA Exam Review, and today we're continuing our BCBA Exam Practice Questions series. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our famous combo pack. As always, when you do pass, let us know so we can include you in our Sunday shout-out. Work hard, study hard. Let's get going. Each member of a fitness club is told that they must complete 30 push-ups and 30 minutes of cardio before they are allowed to leave. What best describes this scenario? Now, this is a little bit of a different question because you're taking two ideas and having to combine them. And that isn't uncommon in our practice, right? Everything we're learning and everything you're learning preparing to become a BCBA or BCABA are just ideas and terminology, interventions. And then it's going to be up to you to combine those things into neat little treatment packages. So in this case, we know that each member, so it's a group of a fitness club, is told they must complete 30 push-ups and 30 minutes of cardio before they can leave. So before reinforcement, before escape, they have to engage in 30 responses and 30 minutes. So it's going to be some sort of combination, complex reinforcement schedule, right? So let's look at our answer choices. A, alternative schedule with an independent group contingency. Well, we know we have a group contingency because it is a group. So let's first break it down, right? When you have questions like reinforcement and punishment questions, when you're dealing with negative and positive reinforcement, negative, positive, you always want to break these things down and make it easier on yourself. So let's start with the schedule. What kind of schedule are we looking at? Well, if we must complete 30 push-ups, which is a ratio schedule, and 30 minutes of cardio, which is an interval schedule, we have to complete both of them. So an alternative schedule is either or. Either you do one or the other. A conjunctive schedule says you must do both. So we know this is a conjunctive schedule. So we can look at C and D. Now, is our group contingency dependent or independent? Well, a dependent group contingency says the entire group is dependent on one person or a small subset of that group. In this case, each member is dependent on who? Well, themselves. As long as they finish their 30 push-ups and 30 minutes of cardio, they can leave. They don't have to wait for somebody else. They don't have to wait for the whole group. When they're done, they're done. That is an independent group contingency. What best describes the scenario? Well, D, a conjunctive schedule, 30 push-ups and 30 minutes of cardio, with an independent group contingency. When you have combination questions like this, most commonly seen in positive and negative reinforcement punishment questions, break it down into bits. Don't try to do it all at once. Make it easy on yourself. And through that process, you're also eliminating wrong answer choices. Understanding why answers are wrong is just as important as understanding why answers are correct. A functional relationship, experimental control, and the scientific level of understanding of control is most related to what dimension of applied behavior analysis? Sticking to that theme of terms, and that's where my brain is right now, but if we're thinking about terms, a functional relationship, experimental control, and the understanding of control, what's the difference between any of those? Well, nothing really. When you have a functional relationship, there's a relationship between your IV and your DV. When you have experimental control, you can manipulate the DV through your IV, the same thing as a functional relationship. And when you have a scientific level of understanding of control, then you can also establish a functional relationship. So all three of these things are essentially saying the same exact thing, just in a different way. And when you're first studying, that can be a little confusing, trying to use all these terms interchangeably. But as you practice, it's going to get easier. Now, the question is asking, these three ideas are related to what dimension of applied behavior analysis? So we have our 7 dimensions, right? So you have to consider, what dimension am I considering functional relationships? Well, A, applied, is what? A, applied, says we need to target socially valid things, right? Things that are going to be meaningful in our learner's life, okay? Applied is not yet saying we're finding a functional relationship. We're just choosing change that's going to matter. If you look at B, analytic, this is where the functional relationship comes into play, because now we're establishing control over those changes. C, effective, just means our intervention is making meaningful change. So it's a little confusing. Applied, we're choosing things to target that will be meaningful. Effective says we're making change that is meaningful. And then D, technological, just says we're writing our interventions and treatments in a way that can be replicated. So if we're looking for functional relationships, experimental controls, the understanding of control, we're looking for the dimension of B, analytic. A behavior analyst conducts a functional behavior assessment on a 6-year-old male. She designs a treatment package that includes a differential reinforcement procedure as well as a response cost procedure. Later on, she analyzes the data and adjusts accordingly. This describes what? What are we describing here? Well, our answer choices, and we rarely jump straight to our answer choices, right? We always do our work up front. But in some cases, you have to get an idea of what the question is asking when it isn't explicit. And this question isn't really explicit about what they want you to describe. So if we look at A, B, C, and D, well, we're looking at our different ideas and behavior. Behaviorism is our philosophy, right? Radical and methodological. Experimental analysis is more Skinner stuff, right? Working in labs, working with animals. Applied behavior analysis is what we do. We work with humans in real life settings. And then practice guided by behavior analysis are what our technicians do. It's what teachers and therapists do. So if we have an analyst who's conducting this assessment, and then she designs a treatment package, including differential reinforcement and response cost, and then analyzes the data and adjusts accordingly, what is she doing? Well, A, behaviorism is just a philosophy. That would be philosophizing on things. That's not what she's doing. She's working, right? B, experimental analysis. Well, it's not experimental analysis because she's working with a human in a real life setting. That's the big difference. C, applied behavior analysis is what we're looking for. We've got the 6-year-old with this full treatment package, and we're going to look at how does our treatment impact 6-year-old. Practice guided by behavior analysis would be whatever or whoever is implementing this, right? So if this behavior analyst has a technician implementing that treatment package, the implementation is the practice guided by behavior analysis. Whereas applied behavior analysis is the process that the behavior analyst is going through of designing the package and looking how it's affecting the behavior of the 6-year-old. So don't overthink this. It's pretty straightforward, but you do need to know the difference. So what does this describe? It describes C, applied behavior analysis. Sophia often flops to the floor and screams for attention whenever given a task demand or an item is removed. How could you put this behavior on extinction? I wouldn't say this is a hard question. It's more of a teaching question, especially in practice. It's easy to forget that when we're using extinction, we're withholding reinforcement. And to determine what we withhold, we need to know the function, because the function is going to tell us what is reinforcing the behavior. If Sophia is flopping and screaming for attention, to put it on extinction, what do we have to withhold? Attention. So what's going to throw people off is says, well, she's given a task demand or an item is removed. Wouldn't that be escape, or wouldn't that be tangible? The question tells us she's doing it for attention, and we have to believe what the question says. That's part of the trap on the exam, is people don't want to believe what the question tells them. What the question tells you is what the question is. You have to believe them. So if they say she's screaming for attention, we need to withhold attention. So A, withhold tangibles from Sophia when she is screaming. Not the function, right? The function is attention. We've got to withhold attention. So B, withhold attention from Sophia when she is screaming. Same as C, continue with task demands as Sophia is screaming. She's not doing it to escape. She's doing it for attention. And when you're putting behavior on extinction, you're withholding reinforcement, which is why the behavior is occurring, which is the function. Okay, that's a very important idea we must remember. All right. And then D, this is an automatic behavior. Well, it's not automatic. Okay. She's screaming for attention. Put the behavior on extinction because it doesn't matter when it's happening. To put this behavior on extinction, we must withhold attention. We've got to believe that the question is telling us the truth. And the question is, the information is just the information. Use it. You have to believe it. You're scrolling Instagram one day and you see the speech therapist that worked with you and your client about a year ago. You haven't worked with either since then, but you thought you would reach out and ask them on a date. Ethically, is this okay? Couple different pieces to this question. First, you've got to consider, can I date this person? And then second, does the time frame matter? Well, yes to both those answers, right? You can date this person, but the time frame does matter. Now, if this speech therapist worked with the client, is that speech therapist a stakeholder? It is. Anybody who's got an invested interest in the outcome of the client is a stakeholder. Speech therapist has an interest in the outcome of the client. They're stakeholders. And you know you reached out, or it's been about a year, I should say. So is this okay? A, yes, since you no longer work with either the client or the therapist. That is true to an extent, but not all the way true. Is there a better answer? B, no, you cannot date stakeholders even when you're done working with them. That's false. There's just stipulations. C, yes, the speech therapist was not a stakeholder. That is also false. The speech therapist had an interest in the outcome. They're a stakeholder. D, no, not enough time has passed to date the speech therapist. That's the answer we're looking for. It's only been about a year. The rule is 2 years must pass before you can date clients or stakeholders. Speech therapist is a stakeholder. Only a year has passed. You must wait longer to date them according to our ethical code. Now, their code might say something different. That doesn't matter. We've got to adhere to our code as behavior analyst. You're discussing behavior analysis and reinforcement with your friend who is a mental health specialist. Your friend tells you that reinforcement is not always effective because occasionally people are not aware of reinforcement even occurring. What explains why this is not necessarily true? This is just a concept question. Your friend, the mental health specialist, is just describing a basic concept to you. What concept says that the person does not need to be aware of reinforcement in order to be reinforced? Well, A, automaticity is what we're looking for. Automaticity says you don't have to be aware of reinforcement for your behavior to change. It doesn't matter if you think you're reinforced or not. Your behavior can change either way. B, contiguity has to do with the closeness of the consequence. C, contingency is our if-then statements, or ABCs. And then D, temporal relation is just space and time, right? The occurrence of time. And temporal relation is much more related to contiguity than it is to this idea. The idea that your friend is describing is automaticity. It's the concept or the idea that regardless of awareness of reinforcement, it's still effective depending on if the behavior changes or not. If your behavior changes, it doesn't matter if you're aware of the reinforcement. It's been effective. Which of the following examples lacks formal similarity and point-to-point correspondence? Okay, so which one lacks both, right? They lack formal similarity and point-to-point correspondence. Ignore that has. So formal similarity means the two responses look the same. So I talk, you talk. I read, you write, I write. They look the same. Point-to-point correspondence means the response is identical, right? I say ball, you say ball. I write dog, you write dog. So we're looking for examples that lack both. They don't look the same, and they aren't the same. A dad says, hey, son says, hey, dad. It isn't point-to-point, but it's formally similar because says and says, speaking and speaking, are the same. B, a sign says, watch your step, and a mom says, be careful. Well, one is written, it's a sign. Says is spoken. They're not formally similar. Watch your step, be careful aren't point to point. B looks pretty good. C, a book says it was the best of times, it was the worst of times. And Claire reads, it was the best of times, it was the worst of times. Book says Claire reads, not formally similar, but point to point. And then D, Bob says what, and Bill says what. Point to point and formally similar. The only one that lacks formal similarity and point to point is B. Sign says, which is written, and mom saying out loud is not formally similar. Watch your step, be careful is not point to point. Formal similarity, point to point, very important you understand what those mean. Difficult concepts at first to really internalize, but once you understand them, right, you'll never forget it. Yesterday, a technician observed a client grab his stomach and tell his parents he had a stomach ache right after his parents told him to get ready to go to church. The day before, the client did the same thing when his parents said to get ready to go to the store. The technician is describing what level of understanding relative to science. What are our 3 levels of understanding? Description, prediction, control. Description is simply describing an occurrence of behavior. Most basic thing, right? You're just telling me what happened. If the technician said, well, I saw the client grab his stomach, this is what it looked like, that's description. Prediction, now you're seeing a correlation after repeated observation. The technician is in this zone, right? A couple days ago, Client grabbed their stomach when the parents said, get ready to go to the store. Today, client grabbed his stomach when the parents said, get ready to go to church. Now we can start to predict what might happen when the parents say, let's get ready to go somewhere. We're seeing a correlation. See, control is back to our functional relationship. We have yet to manipulate anything. And if you're not manipulating anything, you can't have control. You have to remember that. You can't have control, can't have a functional relation if we haven't yet manipulated anything. We can predict a functional relation, we can predict correlation, but until we manipulate, we don't have control. Well, the technician is describing what level of understanding will be prediction. Excellent. Check out behavioranalyststudy.com for all of our study materials. Let us know when you pass so we can include you in our Sunday shout out. Work hard, study hard. See you soon.